This is Speak Up on the CWPhilly.
Good morning, everyone, and welcome to Speak Up here on the CWPhilly. I'm Natasha Brown. Summer camp is a big part of children's lives, but for some kids, it hasn't been a possibility up until now. And coming up, how Dragonfly Forest helps empower children with special needs. But first, this morning, the Hepatitis B Foundation recently launched a new campaign. It's called Hep B Free Philadelphia. It's geared towards eliminating hepatitis B and liver cancer in Philadelphia through increasing testing and vaccination. And joining me this morning to talk all about this initiative is the Executive Director of the Hepatitis B Foundation in Doylestown, Joan M. Block, and Dr. Walter Tsou is here as well. Dr. Tsou is the former Philadelphia Health Commissioner, and welcome both of you to the show. We appreciate you being here.
Well, thank you.
Well, let's just start by talking about the Hep B Free Philadelphia initiative and what it's all about.
So we were pleased to have the support of the Health Commissioner, Dr. Donald Schwartz, and Mayor Nutter. We had our first public event last Tuesday at City Hall, and Dr. Schwartz made special comments and then presented the Mayor's proclamation in support of our new public health awareness and education campaign to promote increased awareness about the problem of hepatitis B and liver cancer.
Yeah, and it really is a problem here in Philadelphia. That's why it's so important that this initiative is here in the city.
It is.
And
right.
Dr. Tsou, you can tell us a little bit about what hepatitis B is.
Yeah, hepatitis B is a virus. It primarily affects the liver, and of course it can cause inflammation of the liver, which can lead to scarring of the liver and subsequent cirrhosis of the liver. It also can lead to liver cancer and liver failure. So this is a very serious virus, and it's one that is actually treatable and preventable.
And how do you contract the virus?
Well, the way you get hepatitis B is that you are infected with body fluids that have hepatitis B in there. So the primary ways in America that people get hepatitis B are either through sexual intercourse, through the sharing of drug needles that are infected with hepatitis B, or perinatal transmission when the mother has hepatitis B and transmits it to her newborn baby.
Yeah, and obviously this campaign is in effect because you don't think there's enough awareness about the virus. Tell me what you want to accomplish with this.
Well, what we're hoping to do is, well, I'll give you a few facts that people may not be aware of. Hepatitis B was discovered 40 years ago, and yet there is a good and safe vaccine that's actually manufactured by 2 companies in the Philadelphia area. And there are 7 approved treatments to control the disease. And yet, if you would ask the average American, most people don't know what hepatitis B is. And yet, when you look at the numbers, the highest risk group for getting new hepatitis B infections are African American adults. The highest risk group for chronic hepatitis B infections are Asian Americans. So 1 in 20 Americans has been infected with hepatitis B, and yet most Americans don't even know what hepatitis B is.
Yeah, that's really a startling statistic.
In fact, it's quite striking that worldwide, something close to 2 billion people, almost 1 out of every 3 people in the world, have actually been infected with hepatitis B. So it is really much bigger than we could possibly imagine, I think.
Yeah, those are just amazing stats and disturbing stats. Now, do you not know that you have it? Or tell me about, I mean, what are the side effects, the symptoms?
Well, actually, that's actually one of the serious parts of this, is that most people are unaware that they are actually infected with hepatitis B. And the only way they might discover it is that they have some blood tests done, and they might find their liver tests aren't working right, and then they do subsequent testing and find out that they actually were infected with hepatitis B. So we are, part of our campaign is to increase awareness so that they can ask your doctors to screen you for hepatitis B.
Yeah, is that not a normal screening, or what happens usually? I mean, do you have to ask for that? It's not something that you would normally get screened for?
Well, it depends actually on the suspicion of your doctor, but it's a test that most doctors usually don't routinely screen for. So that's one of the things that we're trying to raise awareness. There are some populations, like newborn pregnant mothers and among Asian Pacific Islanders or African immigrants, who probably are at higher risk for hepatitis B and definitely should be screened for it.
You also talked about the vaccinations as well. When would you go about getting something like that, a vaccination for this?
So for right now in the United States, all infants who are born are required to get the hepatitis B vaccination at birth, and basically from birth to 18. So we have a whole generation of kids who are being protected. The problem is there's the highest risk group right now is between 19 and 49, and those people have not necessarily been vaccinated. So one of the things that this Hep B Free Philadelphia campaign, the reason we launched is we are actually modeling ourselves on the very successful campaign that was started in San Francisco. And Ted Fang and Janet Zola are the leaders of that campaign in San Francisco, and based on their success, where their stated goal was to test and vaccinate every Asian American in San Francisco, and they've been phenomenally successful in that campaign. What we're doing is we're bringing it to Philadelphia, and we're going to put our own Philadelphia twist on it. And we're going to actually expand it because unlike San Francisco, Philadelphia is much more diverse. And we're looking to just spread awareness because, as Dr. Tsou said, most people don't know they're infected. Most people don't know that they're at risk. So we just need to raise the noise level and make people aware that they could be at risk and that it's preventable and treatable. That's the really hopeful message of this campaign, is that there's something you can do about it. You know, this isn't another disease where, oh, I can't do anything about it. This is a disease that can be
prevented.
I'm sorry.
And treated.
Yes,
yeah.
yes.
Well, thank you so much. We're going to take a little bit of a break
Okay.
here. You are watching Speak Up here on the CWPhilly, and we're back in just a moment.